The quality of your nursing decisions depends on the quality of the evidence behind them. That is the central idea of NURS-FPX4025 Research and Evidence-Based Decision-Making, a course that helps BSN students develop the skills needed to interpret research, evaluate scientific evidence, and apply evidence-based practice to improve patient outcomes. Rather than relying on habit or personal opinion, nurses are expected to make clinical decisions supported by current, high-quality research, professional expertise, and patient preferences. This course prepares you to become a nurse who makes informed decisions that lead to safer and more effective patient care. One of the first concepts you'll encounter is evidence-based practice, often called EBP. Evidence-based practice is the integration of the best available research evidence, clinical expertise, and the patient's values and preferences when making healthcare decisions. It ensures that nursing interventions are supported by scientific findings rather than outdated routines. Throughout this course, you'll learn how to identify reliable evidence and determine whether it is appropriate for specific clinical situations. Research is the foundation of evidence-based nursing. However, not all research carries the same level of reliability. One of your responsibilities in NURS-FPX4025 is learning how to critically evaluate research studies. This includes examining the research design, sample size, methods of data collection, limitations, and the overall quality of the evidence. Understanding these factors allows you to distinguish strong, trustworthy studies from weaker research that may not be suitable for guiding clinical practice. Another major focus of the course is developing clinical reasoning and clinical judgment. These skills help nurses analyze patient information, recognize changes in patient conditions, prioritize interventions, and make informed decisions in complex healthcare situations. Evidence supports these decisions by providing scientifically tested interventions that improve patient outcomes. Instead of asking, "What has always been done?" nurses learn to ask, "What does the current evidence recommend?" Students are also introduced to evidence-based practice models that provide structured approaches for translating research into clinical care. These models guide healthcare professionals through identifying a clinical problem, searching for evidence, evaluating research quality, implementing practice changes, and measuring patient outcomes. Understanding this process prepares students to participate in quality improvement initiatives and support continuous improvements in healthcare delivery. Strong research skills are equally important for academic success. Whether you are writing a discussion post, completing a literature review, or preparing a research paper, your instructor expects recommendations to be supported by current peer-reviewed sources. Learning how to search databases efficiently, evaluate journal articles, and synthesize evidence into clear academic writing will strengthen every assignment you complete throughout your BSN program. To succeed in NURS-FPX4025, focus on understanding concepts instead of memorizing definitions. When analyzing research articles, ask yourself whether the evidence is credible, whether the findings apply to your patient population, and how the research can improve clinical practice. Connecting research to real patient care demonstrates critical thinking and reflects the expectations of professional nursing practice. Ultimately, NURS-FPX4025 prepares you to become more than a nursing student. It develops the mindset of a lifelong learner who continually evaluates new evidence, questions outdated practices, and applies research to improve patient care. These skills will not only help you earn higher grades but will also make you a stronger, safer, and more confident nurse throughout your professional career. If you found this guide helpful, be sure to like the video, subscribe for more expert academic guidance, and share your biggest nursing writing challenge in the comments. Your question could inspire a future video and help other nursing students succeed.